Kia ora koutou, ko David Lloyd toko ingoa. I'm the General Manager for Companion Animals New Zealand. And this webinar series is part of a campaign to support the work of shelters and rescues around New Zealand. So far in the series, we've heard from Carolyn Press-McKenzie of Hoo-Ha talking about the challenges of shelter animal management. We've heard from Dr. Natalie Dalgray from International Cat Care, who presented a really helpful talk on cat-friendly interactions, and also Dr. Rebecca Scottney from the University of Queensland, who gave us some insight into compassion fatigue and ways that we can help manage this in a shelter environment too. If you weren't able to make any of those talks, then the recordings are available on our website. What I'd like to do now is just share a screen with you. And hopefully you can see that. And just talk a little bit about our shelter webinar, our shelter register project. So we're currently running a pilot program called the Shelter Register Aotearoa, which several of you will be partaking in already and contributing data. The aim is to create a national shelter database to capture data from around the country about the number of animals entering and leaving shelters on a monthly basis. And this is so we can quantify the extent of the problem. To provide solid data, we can take to central government and help create legislative change to get better outcomes for our animals. There are other benefits that we hope that will come out of this too, to help those involved in shelter work, like forums for education and advice, webinars like this, and maybe a virtual community environment for support and resources. So we do have a shelter webinar, a shelter register Aotearoa Facebook page set up as well. And you can contact that if you would be interested in joining that. We're now 4 months into the program, and the data is already proving to be really useful in supporting several campaigns being presented to MPI and also to local councils. And we're currently working on the pilot report, which covers the data we've collected from June, July, and August. We hope to have that ready to publish sort of internally in the next few weeks, and then all things going well, we'll publish the October, November and December data in the early part of 2023, and our intention is to make that public. For anyone that hasn't signed up to the pilot, if you are serious about wanting change in the shelter industry, please consider joining the program. The more data we have, the more compelling the case, and the more obvious the need to find solutions to the overwhelming problem of animals coming into shelters. So that's enough about that. And from me, I'd like to introduce Dr. Jess Beer. Jess has 20 years of experience in the companion animal clinical practice and has been working specifically with behaviour cases since 2014. Jess presently works in first opinion practice, rescue organisation, and offers private behaviour consulting. She is invited to speak at tertiary training institutions and private veterinary clinics, as well as being a regular contributor on radio and television. Jess is a great believer in preventative veterinary health care by providing compassionate and scientifically based puppy and kitten programs to pet owners. We are very lucky to have Jess with us tonight to share her knowledge and expertise in this area, and we are very much looking forward to hearing her talk. Forgive me while I just get myself off screen share here and pass you over to Jess Beer.
Thank you so much. Hopefully everyone can hear me all right. I'm going to share my screen as well, I think, if that's all right. And there we go. Is that full screen for you guys?
Yep. Looks good.
Awesome. Fabulous. Oops, I'll go back a little bit. Thank you so much. I'm actually really honoured to be invited to talk with Companion Animals New Zealand. I admire the work that they're doing. Since I arrived in New Zealand, it's been amazing to see you go to strength as an organisation and really making a difference in New Zealand animal welfare and care, which is just fabulous. And this topic in particular, so behaviour, shelter behaviour in shelters, it's an absolute passion of mine. And I think if I had 3 lives, I would probably be full-time shelter work, full-time behaviour, and then full-time general practice. It's quite hard to fit it all in. But absolutely, ever since I've been a vet, it's been part of what I wanted to do. And as David outlined, I've been a vet for a very long time, definitely got some grey hairs. And in that general practice, I have done a lot of overseas work, which was very much about shelters. So I've got some little bragging photos up there. On the left is my boy Oscar, who was a 3-week-old rescue through a clinic, and there he is looking after one of the many foster kittens that I have come through. On the right, there's a little dog there that you may or may not be able to see, where I worked in Soy Dog in Thailand. So very much a large shelter, had over 400 dogs there, as well as in clinic veterinary service, as well as going out into the community to do spay and neuter. And absolutely eye-opening to see the range of abuse and neglect that some of those dogs were suffering, and the absolute resilience of both the animals that were cared for and the staff who worked there. And down the bottom is my beautiful Isabella, who passed away at 17 and a half years of age. And she is very much the passion of what a street dog and what a rescue dog can give you. She was found roaming the streets of northern Budapest and then came to live with me, gave me Campylobacter, and then carried on enlightening my life forever beyond that. I also have worked with the SPCA in Auckland. I was very lucky to be part of their clinical team, and I do continue when I can to help them with behaviour as well. So that's a little bit about me, where I come from. I do very much target behaviour from a combination of both the veterinary point of view as well as a welfare point of view as well. So hopefully in today's talk, I can cover just tiny bits, I think, of what this massive topic is, to hopefully refresh some of you. Will know everything I'm going to talk about, and so a little reminder never hurts, and then hopefully a few more little pointers that might help when you are actually working with these dogs. So I'm just going to move this slightly so I can read my slides a little better. There we go. So I wanted to start from the beginning. If we want to deal with behaviour in any animal, and in this case dogs, I think to understand why they're behaving in a way, we need to empathise with them. We need to understand why that behaviour is occurring. And to that respect, we've got the science that backs us up. And anthropomorphizing, that used to be a really, really bad word, but I think we've got enough evidence now. The wonderful study in 2016 that indicated on MRI that the dog's brains are reacting in exactly the same way as ours do, in what we would assume to be a positive or a negative fashion. Further down, there was the oxytocin loop. Lots of pop culture media out there was saying, oh, dogs do love us, they shoot oxytocin. But the reality is it's true. And I think the more we learn about dogs, the more we can understand why they are behaving the way they do, and we can then target the emotion behind it, which is the key to true behavioral modification and reform, especially in light of dogs that are coming from a disadvantaged or traumatic background. And exactly what it says there, by recognizing their ability to feel happiness or joy, or the words that we would associate when our brain is doing the same thing, when our nerve pathways are firing in the same way, I think it's understandable that dogs can most likely feel the negative emotions that we also feel, such as depression or anxiety. We do diagnose anxiety in dogs, not necessarily depression, but I tend to use it as a sort of a synonym for how they might be feeling. And no doubt a lot of you have seen dogs displaying behaviors that are consistent with the same emotional states that humans would be in when they've also suffered a traumatic situation. So I think when we start to, okay, we've got behavior that's good, behavior that's bad, let's start identifying the underlying emotion that's causing it. And then it's going to be easier to come up with a plan that protects those dogs from further trauma or further damage. And it allows us to implement the right behavior modification or potentially the right medication to actually tackle why they're behaving in that way. And ideally, when they come into a rescue situation, prevent that pathway of trauma and damage continuing on. So I thought I'd cover over a little bit of an idea of what kind of animals are coming into our organizations. And one step is the history. So the history of this animal. On the right, there is a picture of someone called Tinkerbell, who some of you may know. She came into a vet clinic because the owner wanted to get rid of her because she couldn't walk. She was supposed to be about 12 weeks, but if you can look at that photo, I think she was far less, and she was almost 80% paralyzed, couldn't walk at all. So she came home with me as a foster under the care of one of the rescue centres in Auckland. She has won a lot of fans and now actually has her own social media presence as Tinkerbell the Wobble Dog. But it was just a little picture to highlight these are individual beings when we're talking about, oh, where did they come from, what did they do? And in this case, when we're talking about shelters or private rescues, were they abandoned? Were they found in a box? I think everyone's heard of the litters of puppies dumped in a box in a park. Were they uplifted? If we're dealing with some of the larger organisations, perhaps these animals have been taken off owners who are showing clear negligence or cruelty. And then there are the surrendered animals as well. And I think it's worth identifying sometimes these animals, through no fault of their own, and the families, through no fault of their own, have to give up a beloved family pet. So these different areas from where these animals come from are going to play a role in how they behave and how we might best transition them into a foster lifestyle or a shelter lifestyle. So once we've got that background history, we then bring on to the moment of their arrival as well. And I'll just keep throwing out stories. This little girl was a dumped litter from Bay of Plenty, I believe, with another wonderful rescue organisation in Auckland, and she and her two sisters came to stay with me. You can see she's a little underdeveloped, but she's certainly come into her own and been adopted by a phenomenal nurse and trainer in Auckland. She's now called Juno, and teaching the world about how to cope with adolescence. But when they arrived, those three puppies, they were exhausted. They'd been found, I believe, again in a box. They were riddled with diarrhea. So I've been through the trauma of having a litter of puppies have diarrhea all over my house for 3 weeks. They had illness that they had to deal with. They slept, I think, for almost a week before they had the energy to come up. So we want to start being aware of what struggles they're dealing with in that moment of arrival, and potentially whether we need to be quite urgent in how we manage that so that we don't allow that particular presentation, be that diarrhea, trauma, broken legs. They need to be dealt with urgently to minimize the effect on their emotional state and their behavior as they continue to stay in the rescue facility. So hopefully a lot of you are aware of the rule of three that we tend to refer to a lot in rescue or in adopting dogs, which is 3 days, 3 weeks, 3 months. And they're all what I would probably term transitional phases of changes in behavior as the dogs become more or less comfortable in the situation that they've moved to. And what we want to be aware of, if you're on the intake side of shelter work, what can we do and what will we expect in that 72 hours of when they first arrive, catering for things like their history? You know, have they experienced abuse? Are they going to mistrust male attendants rather than female attendants? Will they need veterinary care? In that veterinary care, are they going to experience more trauma? And as much as I love being a vet, I don't deny it can be an uncomfortable experience for some pets. Then there's simple things like sensory overload. They may have come from being locked in a garage for the first 4 months of their life, and all of a sudden they're in a shelter, they've seen 10 different people, there's noises, there's clashing, there's banging, there's rich food that they've never seen before. All of these things are assaulting their senses and going to potentially soothe them if they desperately need that, or actually become really overwhelming. So are they going to shut down, or are they going to get hyper aroused by that sensory input? I put affection down there as well, because I think a lot of people rescue and think that love alone will fix this animal. And sometimes that affection, especially from a human in the form of physical affection, can be quite offensive to a dog that has either not experienced it or experienced it in a negative fashion. So I'm not saying do or don't, I'm just being aware and highlighting that what we consider to be affection and love may not be exactly what that dog needs at that time. And then what we're often observing over that 72-hour time period is a decompression as they adjust to what their new life may be. And I think sometimes people have a rescue dog which has perhaps been found on a street, taken into someone's house, then moved to another house, then put in a car and traveled for 4 hours to go to their new location, maybe in a holding pen or a veterinary clinic for 2 days. A lot is going on, and we've got to be aware that they really need to be in a stable place to truly allow that 72-hour decompression to occur. And then I've thrown in that lovely little comment of temperament assessment or temperament testing. I know it's a big topic in the shelter world, and whether you decide to do that on initial intake, whether you wait for the 72 hours, what is involved in that temperament assessment. there's no right and wrong. We've got evidence that gives us more and more information on what we can trust in those particular assessments. But I think what it's worth noting is that if you have a dog that comes into your facility, you need to make note somewhere in their paperwork of everything and their responses to everything. It's not going to label them. Say they've growled and snapped at someone who put the slip lead on. That doesn't label who that dog is, but it is important information to know when you are then moving on to determine what behavior modification or environment you want this dog to be in. So as you can see, I think we're about 4 or 5 slides in, and it's a huge topic. There is a lot going on for these dogs. And I think it says a lot about their resilience and the absolute wonder that is a dog, I think, in regards to being humans' best friend. They tolerate a lot, and they turn into amazing, amazing friends. So I thought I'd touch on the common themes of what a lot of these rescue animals will come to you with. I think there's some general trends that we can see. So this little puddle of puppies is actually taken from the website of a clinic I worked at in northern India. Now, I worked in Thailand and India, and they're both 2 places where euthanasia is not necessarily accepted. So it changes again the options that you have for dealing with these animals. So that's a whole other topic in itself, but I just thought I'd point out that these pile of puppies, they just hang out in doorways and they live a really, really wonderful life until they get hit by a car, and then they need to be helped. But moving back onto what I identified as common themes, individual genetics, the early experiences, the present experiences of how they come into the shelter, again, breed predisposition. There's been some very interesting papers come out recently in regards to how we can identify how an animal might behave based on their breed and genetics. And I don't say that a breed defines how a dog will behave, but we can recognize that there are predispositions, such as your herding dogs will track and stalk. Your hunterways will probably be vocal. Your beagles will probably be vocal. Your bully breeds like to pull on things and bite on things. And we need to be aware of that when, again, it comes to supplying or providing these animals with an appropriate home and with an appropriate behavior modification or behavior enrichment program. And then, of course, we often have a lot of these rescue animals who've been neglected. Now, not necessarily willful neglect. It could purely be just ignored neglect or unaware of the neglect, be that physical or emotional. I want to just touch on the difference between a breed predisposition and individual genetics. So what we find, unfortunately, with a lot of backyard breeders who aren't your pure breed bred for pet, the individual genetics are often mothers or roaming fathers who are not particularly sociable. So we've got the line and the lineage of potentially antisocial dogs or dogs that were bred for hunting or dog fighting. And we have to recognize that that is going to play a role in the behavior of these animals that we rescue. I thought I'd highlight, very similar to the earlier posts, earlier pages that I put up in regards to how their brains are working and what the chemicals are doing, and does that mean that the dogs are depressed? And as I mentioned, I think it's better to use just as a synonym for how dogs' emotions might feel. And the reason we point that out there is that when I'm dealing with behavior problems, or you're in a rescue and you're determining what to do with an animal that's starting to develop problems, is that it is almost always the consequence of an altered emotional state. And that can be fearful, aggressive, reactive, hyperactive, or just withdrawn. And it is often due to chemical imbalances. And the reason I bring up that is that there are benefits to incorporating medication into helping with some of these more extreme dogs, so that we prevent a further deterioration in their behavior and their mental state whilst they're in our care. And I think it's clear enough to say that in those extreme cruelty cases where there's clear physical damage and the way that they're behaving, it's equivalent to humans. And I have diagnosed many a dog with post-traumatic stress disorder, because the way their brain is working and the way they cope with novelty in their life moving on is very similar to humans. And as with humans, often medication and behavior modification protocols are put in place to help them cope better, because we can't necessarily undo the damage, but we can give them better coping mechanisms. So when we're looking, and this is for any dog, what kind of events might cause that emotional upset, that emotional dysregulation? Moving to a new home, fireworks, thunderstorms, new baby, change in the household, abandoned at a shelter. That's clearly the topic that we're talking about today. Death of a family member. I've had a lot of questions actually this year about owners or family members where the pet has truly mourned the loss of either a human family member or another animal family member. And it takes them, I would in general say, about a 4-week mourning period for them to recover from things like that. And that again could be considered a depressive state, just as in humans. We've got the emotional dysregulation of dogs that have a lack of stimulus. And I have no doubt that you all agree we want to move forward with legislation that will prevent permanently changed dogs outside of just the simple provision of shelter and water and food. Because that lack of stimulus can both cause depressive states in their brain and also prevent that dog from learning normal coping mechanisms for how they would deal with stress in the future, or how they would interact with normal people, which is why we often see a lot of very frustrated behaviours coming out of dogs that have had that lack of stimulus and then are suddenly exposed to a lovely home full of all these things to do, and they just can't cope. And then obviously we've got the abuse, which unfortunately does happen, both physical and mental. And then keeping in mind that predisposition to anxiety. So that falls back again on where have these puppies or these dogs come from? Has their individual lineage come from dogs that are already very anxious, both due to their life experiences, but also potentially that genetic line? And all of these things is all coming into play when we start saying, why is this dog behaving in this manner? And that's where it's just not simple to say, this is how we fix it, or this is how we do it. And I never like to use the term fix it in behavior, because it's not really what we do. Behavior is an expression of an emotional state, and it's in constant flux. I want to make sure we're understanding, and obviously I'm biased as a vet, it's so important to have vets as part of your team. And very few shelters, small shelters or private rescues have their own vet team. They're often having to go to clinical practices, private practices, corporate practices to get that help. And it's not necessarily the same vet that you're going to see, who doesn't necessarily understand the situation that these dogs are in, that it's different to a dog in a loving home that presents with maybe a similar issue. So I'd love to see more vets involved in shelter medicine. There are wonderful opportunities overseas to learn about that. It's pretty small in New Zealand, so let's push for more vets to get involved in that, because when they first arrive, we need to be more proactive with managing their pain and managing their anxiety. Otherwise, that golden window of 72 hours, if they're in pain and they're extremely anxious, their brain is learning that that is an experience they're going to have in the shelter. And we really want to stop that from happening, so that all of their interactions in this new environment are as positive as possible. And we're starting with a lot of negatives. We're starting with animals who maybe don't have the resilience, who don't have the experience, and they're potentially going into a very stressful situation, which is a noisy, loud kennel. As we're not all vets here, I think it's worth identifying there are non-prescription supports that you can use for anxiety. Unfortunately, it can be financially not possible for a lot of people, but I am a big advocate for Adaptil. It's not going to completely resolve, it's just going to help, and everything that can help should be utilized. Aromatherapy, lavender is probably the primary one, but there are other options there as well. There's your nutraceuticals like Carmex and Nutrazil, and then your Royal Canin Calm, which is a great option as well for longer term management, but it is only valid for the dose for dogs under 15 kilograms, which I think safe to say a lot of our rescue dogs are well over that by the time we see them. So if you are interested, or you do have a vet that wants to know a little bit more about shelter work, I think let them know that there are places such as myself, and I have no doubt that the SPCA and HUHA have a lot of experience that they would be willing to work together and basically improve the state of the veterinary understanding of shelter work and shelter medicine. So moving on to you guys, and I probably want to shout out a big thank you to you all, because it is exhausting work, and I don't know how so many of you do it for so long. I did join in and listen to the Compassion Fatigue talk this morning actually, and everything that Rebecca said just resonated with me, and I think it's so important that we keep talking about it, because I think everyone who's worked in the veterinary industry or the shelter industry has known someone who has not coped. And we need to be there to support each other. And it's so unfortunate to see some of the social media that's out there that is not supportive of everyone, because all we want is what's best for these animals, I think. But if you're not healthy yourself, you're not going to be able to do your best for them. There's my little mental health splurge out there. So for practical skills as a shelter worker or a rescue worker is you need to understand dog body language. It's just, if you want to work with dogs, you've got to know their language. You've got to be able to read them and understand them, because if you don't, you're going to make the wrong decision. You're going to push these dogs beyond what they can cope with. And what is unfortunate is you're going to believe some of these really unregulated trainers and advice out there that tells you how to interact with an animal, and it's actually going to make them worse. So on top of understanding their body language, what's really useful is to recognize how your body language is influencing how that dog is responding to you, because your language, your tone of voice, your stature, all of that is what the dog is reading off you. They're unlikely to listen to you. They may not know what you're saying. They may have been in an environment where English, for example, wasn't even a language that was spoken. Your words don't mean as much as we think it does. We're a little bit egotistical in our language. So start recognizing what your body does. And if you haven't done it before and you do a lot of work with dogs, film yourself and watch it back and look to see, even on mute with no words, how is the dog responding to what you do, not what you think you're doing and not what you think you're saying. The other skill is managing, evaluating, and assessing the environment. This is huge, because this is how we set them up to succeed. What environment do we need them to be in? If you've not heard of Temple Grandin, she was groundbreaking when it comes to recognizing how the environment influences the behavior of stock animals and how you can manage and alter the environment to improve their quality of life and your ability to handle them, reducing stress and improving your ability to do what you need to do with them, such as moving them around a facility. You need to understand the use of positive reinforcement training. There is no place for positive punishment in the use of training in rescue and shelter work. And I'm disappointed to see that some shelters are still using that, or using trainers that recommend things like shock collars or leash corrections. Why would we continue to put more trauma on these animals when we know already that they're traumatized? It may resolve what we consider the problem, but it's not going to be helping their emotional state. So I think it's just essential that if you don't know how positive reinforcement works, or you're swayed by what seems like a board and trained rehabilitation for dogs that can't be rehomed, you need to rethink what is actually happening to that dog's emotional state. You need to recognize the importance of the senses. Now, if you don't already know, dogs have a really good sense of smell. They also hear things at a different pitch. And so when we're looking at a shelter and the facilities, we need to recognize how the dogs are interpreting that and what might be overwhelming them. In particular, noise, reflections, light. One of the biggest stresses in a shelter dog's life is their inability to sleep and to rest. When they need 16 to 18 hours a day of sleep, and they're potentially not getting that, then that is going to make it harder and harder for them to cope. And it's one of the main reasons we see an escalation in unwanted behaviors in shelter dogs. The other thing I want to put there at the bottom is you can't do it all yourself. We all have many, many skills. I do not know everything. I never claim to know everything. And there is always someone out there who will be able to help you. It could be to help identify another interpretation of how to help this dog. It could be another training technique. Seek help. It's a very lonely world, dog training and dog rescue, any animal rescue. And I love the fact that we're bringing together a shelter register. We're bringing together an awareness of the fact that there is a need for shelters and rescue in New Zealand, and to have resources where people can find help. I tried with a couple of other colleagues to put something like this together about 7 or 8 years ago, and I'm so glad companion animals are, because it's really difficult, but we need it. And don't be afraid to ask for help, be that for your particular animals or for your staff or for yourself. So when we look at the skills that you need and what you need to understand, I hope I'm keeping on time. Body language resources. If you don't have a copy of Sophia Yin and Lily Chin's little pictograms, you can download them for free from Lily Chin, which is doggydrawings.com. And this is to hand out to all of your foster parents, to all of your people who are adopting a fearful dog for the first time. It's also They've got many others that talk about how to implement positive training. How do you desensitize and counter condition? Because you can't expect a new owner who's just adopted a very fearful dog to suddenly know how to train a fearful dog. So utilizing a lot of other resources that you can pass on is really useful. If you yourself feel you need to brush up on your body language, because the more you watch dogs, the more you will learn. And we want to make sure we're learning the right thing, not what some TikTok star says is actually happening. You want to know the truth. And I've listed a few particular expertise or experts that you can go to. So obviously, Dr. Sophie Yin, absolute guru. I'll also be mentioning her later on in regards to handling. Kristen Cristejo, she's a trainer in Canada. I often use her videos to explain body language to my clients. Eileen Anderson, phenomenal assessor of body language, and she has some amazing detailed videos. And then if you're looking at doing courses or short-term blogs and webinars, you've got ASPCA Pro, Maddie's Fund, the Humane Society, and Battersea Dogs Home, which has some really nice little snippets for people to learn. So learn, because the more you watch, the more you'll identify, and you often have to slow-mo it down so that what you think is happening is actually what's happening. Because if we don't understand what the dogs are saying and how they're feeling, we're more than likely to make the wrong decision when it comes to managing their behavior. So this is a little video. It's really short and hopefully it's not too loud, that I thought was brilliant. There's one picture in there of a dog, I believe has a shock collar on. I don't like, ignore it. The rest of it is outlining basically what you're looking for with body language. So listen in, not me talking now.
Race tackles, lip licking, whale eye and skin twitching, ears back, that tail is tucked too. This dog doesn't want you to hug him or touch him. He's stressed, give him space, he'll bite you. Eyes wide, smooth nose, mouth closed, that tail's horizontal. Lean forward, ear twitch, what was that? Hope you've got a good hold on the leash, cause your dog is about to bolt after that bunny. Mouth is slightly open, head hires up, tail soft, loose, stance even, weight on all fours. This good boy needs a scritch on his chin, then a belly rub, he is relaxed. Folded ears, licking lips, tail is tucked, posture hunched, soft eyes averted, mouth closed. Sad pupper hates it here, take him home, give him love, no dog deserves to live here. Eyes wide and staring, tall and rigid, posture, tail erect, hey, you might see teeth. This should be obvious, don't take it personal, he's pissed, maybe don't touch him. A play bow or mirrored move, soft ears, broad tail with mouth open, tongue might be exposed. It's playtime for pupper, get ready to derp out, hope you're down for a game of chase. Dog body language is not complicated, you just have to pay attention. It's not learning Mandarin, trust me, I tried that one. Fluency's 4 clicks away. YouTube's a great teacher, type dog body language into the search and see results. You cannot communicate if you don't know what your pup is trying to tell you. This is Lucy like soccer, see that playful posture, while Rocky, he likes to play tag. Now I'll play group reading with language, do you see? That plays not push and pull, look at that back and forth, technically speaking, diagonally bilingual, depend that on your bucketness.
So I hope you all found that as amusing as I did, and it's brilliant. Watch it, keep watching it, and you'll see all of those words coming up again. It's fabulous. I'm sorry I paused that in the middle trying to read the chat. So body language, that's like a one-day course in a 1.5 minute video, but yes, you need to learn body language. Once we know body language, we can start getting into a little bit more detail about the distress behaviors that a lot of us have probably seen in a shelter or foster dog. So we've got hiding, shaking, barking, I mean, everything that is there. Hyperarousal, again, there's a lovely doggy drawing that highlights what that is. And I want to identify that one as well. It's very common in some of our bully breeds. It's very common in some of our adolescent dogs. I think we all recognize that the vast number of abandoned or surrendered dogs are often in that adolescent phase of 10 to 18 months where they're an absolute nightmare because they're a teenager. And hyperarousal is their inability to control themselves. It's their inability to make the right choice. We all know teenage boys who go driving when they shouldn't and, you know, do things that they're dared to because of that dopamine rush, potentially testosterone involved in there as well. So hyperarousal is a very difficult one to manage, and it's frustrating to manage as well because you're often trying to do that with a dog that doesn't have a relationship with you yet. So a lot of the advice I would give to an owner is different when it's a shelter dog that you've only known for 2 days. We don't have that trust built up to allow you to redirect them appropriately to get their attention when they're distracted by something. But it is a sign that the animal is potentially not coping, and we don't want to label that as being a naughty dog or misbehaving or just needs a firm hand, because that's not often applicable. It's another reflection of an underlying emotional state. We've then got displacement behaviors at the bottom, and that can be a little less obvious because you may have a dog that's not doing anything bad or naughty, but they're sniffing when they shouldn't, they're licking when they shouldn't, they refuse eye contact, they do things that aren't immediately offensive to us. But if you're not in tune with recognizing the details of body language, you may not recognize that there's a dog that's uncomfortable because they're wagging their tail, they're walking, they're sometimes pulling on the lead, they're sometimes not. But recognizing those more subtle signs of an underlying stress or an inability to cope is important when we're trying to help these dogs. So when we've recognized, and sometimes it's blindingly obvious, otherwise it's not, what do we do about it? So we need to set them up to succeed. A lot of these pets have never had success before. Even when they've done the right thing, they've either not been rewarded or they've been punished for it. So we want to make sure that we have an environment that is safe, that is as calming as possible. And we want to allow them choice that gives them the ability to choose something that helps them cope. So that's simple as having a crate that they can hide away in. Maybe they don't want to hide, maybe they want a ramp to get up high. So again, looking at what facilities you've got, what environment, what type of bedding. Maybe they don't like a lot of soft bedding. I see one thing that's difficult in a lot of shelters when you have stressed dogs that potentially eat or destroy blankets, they're not allowed soft furnishings. And so we've taken away one source of comfort. How can we provide that comfort in another way? You want to potentially have, I mean, this is where we all want the ideal facility where they've got indoor, outdoor space that they don't have to look front on. You should never have cages directly opposite each other. And it's difficult. So we often have to say, well, this is what we can't change. What can we do within that environment to make it successful for them? They've got choice, they feel safe, and allows us to interact with them in ways that are always positive. So sometimes as simple as, how do I get in and out of the cage without either scaring them because of noisy clanging things, or do they have a place to hide behind so that when I come in I can just stand still for 5 minutes without having to directly face them and do things that can make them uncomfortable. And then when we are interacting with them, this is where paying attention to our body language. What are we bringing to them? Is it toys? Are we using soft voices? What are we doing that makes them see us as a good thing? And then medication. Don't be afraid of medication to help dogs that are so anxious, they won't take food, they can't engage with you, they're terrified. There's nothing wrong with helping them feel better, even if it's temporary or long-term. But again, these things need to be discussed with vets, and the more vets we have involved in behaviour and shelter, it will help New Zealand. So when we are going to interact with them, what we need to do is respect their space. And a lot of the time we may feel rushed to interact with them to prove that we're a good thing. And that's not the right way to go. It's really important that they don't view us as a threat. And ideally we give them time to approach us. Now that's not always possible, especially in emergency situations. So there are other skills that you will need to deal with it. But when we've hopefully got them in a location that's going to be long-term, not temporary, they're not transitioning through facilities, we can give them that time and just put lots of little deposits of positive things in there. We just walk past, humming, toss a treat in, but we don't have to force them to engage with us. They may not be ready to do that. When we are interacting and we're looking at things like putting them on a leash and taking them for a walk, we need to trust our gear. We don't want leashes that are going to slip off, harnesses that are going to break, things that are going to be jangly and uncomfortable and unpleasant. Because if they have a traumatic event with the gear that we're going to be using with them, they're not going to trust us or that gear in the future. So simple things like that. And plan. Failing to plan is planning to fail. So making sure when you have a training session set up or an interaction session, know who's going to be there, what you're going to do. Have warning signs so people don't come barging into the room that you're trying to work with a really, really fearful dog. And then find what sparks their joy. Is that it's a little bit, I think, what's the Marie Kondo term? But it is true. Everything is different for each individual dog, and it may be that a particular individual is someone that they like, a certain perfume, a certain food. Give them a chance to see what makes them happy, or in some cases just makes them less afraid. And you want to ensure that as many experiences as possible are positive for that dog, so that you avoid further traumatizing. And the bottom one is safety, safety, safety. And I think it's important to recognize, especially in the light of recent news articles this week and this year, that it is important that these animals are not pushed beyond what they can cope with. And dogs can bite, and dogs can hurt, and dogs can be dangerous. And we can't forget that in the face of wanting to rescue them and wanting to love them. So making sure you, your team, and the dog, and any companion dogs, if you're using stooge dogs to work with new dogs to socialize, it is so important that everyone is safe. And again, that's probably a whole other webinar or session. Some simple pointers, I need to keep an eye on my time. Some simple pointers when you're approaching fearful dogs is avoid threatening them. This is a still from Sophia Yin and the Veterinary Low Stress Handling, which I highly advise you all get a copy of if you don't already. Simple rules: don't make direct eye contact, don't reach over and force them to interact with you. More of a veterinary thing, but having non-slip mats down if you're working in a sterile type area or a shelter that's hosed down a lot and they're finding it a bit slippy. Maybe they've got long claws, overgrown fur. You want to make them so that they feel stable and comfortable, and move slowly. I'm talking very fast at the moment, and it's something that I need to modulate down if I'm working with a fearful dog. Slow and steady. You do have time to do it. A lot of the complaints about low stress handling or giving fearful dogs time, people will say, I don't have time. What you don't have time to do is make them worse by rushing in too quickly. You're far better to go slow and allow them to acclimatize to you, either in the room or in their space. So be patient. This is a little video. Hopefully we have time for all the videos that I've got to watch, which is all about a simple thing of body position. So Eileen Anderson, who I mentioned earlier, it's a little video about how a dog approaches her purely based on the angle she's facing.
Does your dog have a space bubble? Just like people, dogs have differing levels of comfort with humans or other dogs in their personal space. Take a look at the following example. Here's Clara playing a recall game with a collar grab. Note how close she gets to me. Now here's Zany playing the same game. See the difference? Zany puts on the brakes when I reach out. Clara doesn't. Many small dogs don't like to be loomed over or have hands reaching in their faces. Here's what that looks like to a small dog. I wanted to help Zany be more comfortable close to me. So I invented a training game where I would reinforce Zany for coming closer and closer into my space. Here's what happened. I drop the treat when she crosses the line. So far, so good. My standing sideways made approaching easier for her. Look how she responds when I turn less than 45 degrees in her direction. And then all the way towards her. It's possible that when I face her straight on, she may think I want her to do something else. It could be a contextual cue. But even so, it's pretty clear she has a space bubble. Here's a side view. The main actions that cause this body pressure include humans standing tall, standing facing front, a direct gaze, leaning over, and reaching for the dog. So I've stopped playing that game and am splitting the activities into separate components. Zany is much more comfortable coming into my space when I'm sitting down, so we're starting there. She comes in close with the mat as a little prompt. The collar grab itself doesn't seem to bother her. So right now we're focusing on the hand motion. This is ongoing work for us. Does your dog have a space bubble?
Sorry, unmute myself. So I really like her video. She's very, very clear. And I think she takes something that's so simple as a 45-degree angle that will completely change how a dog interacts with you. And if we're not aware of that, we're missing out on the finer subtleties of working with, in particular, fearful dogs. And so that dog is actually her dog. That is not a new dog. She has a lot of very scaredy dogs. So she has some amazing insight into it. So I'm focusing a little bit on probably fearful dogs in rescue and what we can do for less so aggressive dogs. I think you really need to be qualified to be working with aggressive dogs. And if you do deal with a lot, you need to have a qualified trainer involved. This is not something that you should be taking on board without that experienced help from you. So just a little pointer there, but I will touch on a couple of ideas later on. So I think what we want to do with new dogs who've come into your facility or your shelter or your foster home is the idea is to reduce their fear of you and their environment. We want positive associations with the environment, and that could be with food, but keep in mind that food may have been poisoned for dogs who've had either food thrown at them or poisoned food. I have one particular beautiful client who they used to throw food over the fence and then shoot her with a BB gun. So she was very, I think it's been a year and a half, and she's only just taken food from her owner. So if food doesn't work, I think what we want to be looking for is more games. And this is where using behavior modification is a really useful tool for working with rescue dogs, especially those high energy ones, because you take a pit bull crossed with a hunt away crossed with a whippet, and you try and make them sit down and be calm in public. And you may have noticed it's not always easy. So we need other ways of instilling a natural endorphin engage with may not be enough. Not saying that I don't love food. I think the internet went a little wobbly there. Hopefully you can still hear me. David, let me know if you can't. What we can also do with games is the contra freeloading theory, which actually increases their likelihood of eating, is if you make it a game. So you give a dog a bowl with some kibble and they're not interested. You put it in a Kong, you throw the food, or you get them doing little tricks, you're going to be more likely to eat. So games is such a fabulous way of creating a relationship with dogs. And I think we've underutilized that as a way of interacting and building a relationship with dogs. Training dogs is not just to make them obedient. It's actually a really useful tool for them to feel confident about themselves and to have a relationship and a reliable understanding of what you want them to do. So we want these dogs to play. And that may be playing with you, maybe playing with toys, and it may be playing with other dogs, because don't forget that dogs are obligate sociable animals. Choice. Not talked about as much as I'd like in the training world, but it is out there, in that giving an animal choice is one of the best ways of improving their welfare. And this is from lab rats through to primates, through to humans, and dogs included. And providing that for them in an environment such as a shelter is really valuable. So having more than one toy, having more than one food option for you, all of these things can improve their welfare and improve their relationship with you. So that if they haven't trusted humans before, they have the option to trust you and it's going to be enjoyable for you. So I've got a few little, hopefully, there we go. So what you also have to remember is it's not what we think is rewarding for them, it's what the dog finds rewarding. So this is where it is very important to read their body language. A lot of dogs will do what we ask, but not necessarily want to or enjoy it. So keep that in mind, that what is rewarding and what is reinforcing is entirely up to the dog. Here's a few really cool things that you can do if you're not already doing it. They're very simple behaviors, very simple training. Nose work is up and coming. It's becoming more and more popular because we know that sniffing reduces a dog's heart rate, respiratory rate, and it alleviates anxiety. So we want more of these dogs doing nose work. It's also something they can do if they are reactive, aggressive, or fearful. So it's a wonderful thing to incorporate into a rescue dog's life. Hand targeting. Again, some dogs are very uncomfortable with that. You may want to use a target stick rather than a hand, but it's a really good way of introducing them to voluntarily interact with you and be rewarded for it. And it can build up to being able to guide them into other body positions, which is really useful for vet care. And also teaching them that they have some control and they have choice to touch you or not touch you and determine what their reward is going to be. Fetch, simple games. Fetch is really good because an animal can be rewarded for briefly later on in regards to enrichment, but being able to chew things is really important, but ensuring you're providing them with safe things to chew. Tug is a great one. If you haven't heard already, tug does not teach dogs to be aggressive. Absolutely not. And it's one of the best outlets that we can give to these dogs, such as your bully breeds and your pit bull crosses, because they love to pull and drag on stuff. It's what they were predisposed to do. You can do that with them. They could do it with another dog, or you can attach things to their environment, such as dangling from a tree or attached to a side that they can pull and tug, potentially stimulate them with some food in there as well. And the other thing is, when you're introducing these games or introducing training, try and do it in a place where they feel safe. Now, some dogs, it may be their kennel, they're too scared to go out, or their bedroom, or wherever they are. Other dogs, it may be an outdoor space where they feel less pressure and less containment. But again, going back to what the dog finds rewarding and comfortable, that's what you need to do for them, to go back to, again, encouraging a positive association with the humans in their life. So here is a little video. Suzanne Clothier created this, called Treat Retreat. And this is the best thing to do with dogs that aren't comfortable enough to be with you. I don't think there's any sound to this, but you can just watch it. Sorry, I'm not sure if it's working. Here we go. So when they show a positive interest in you, they don't have to come up to you for a treat. All that's happening is food arrives. Oh, from where does it come from? It comes from that lovely lady. Get it, find it. Lots of different versions of the same thing. And it may even be with a particularly fearful dog that all they do is look at you and you throw a treat. At the beginning of this video, it did point out that you should do a low underarm throw, or if you're really good, holding a treat in your hand and flicking it so that there's no physical expression like they're going to be hit, which can be obviously quite intimidating for some dogs. And this is where patience comes in as well. Short training sessions, short positive experiences. So again, treat retreat, if you look that, Google it up, YouTube, there's lots of good videos. The other really good game to use to provide consistency that again doesn't necessarily involve a dog having to interact with you, although in this case the dog is quite close, is the pattern games from Leslie McDevitt. She, I believe, created Controlled Unleashed, could be wrong. And this is the 1, 2, 3 game. So this dog has already learnt it, but is now practicing it in the presence of, I believe, a threat, which is the small child. Very threatening things they are. There are a few different versions of that, but what we're aiming for the dog to learn, and you can stretch out for 1, 2, 3, that 1 means 2 is coming, means 3 is coming, means a treat is coming. So it builds up their ability to trust that something good will happen. It's a really good way to keep a dog focused on you, and a really easy game for them to do. They don't really have to do anything. They just have to be aware of you and acknowledge you and listen. And it starts to build up that relationship. Again, she has a few other little pattern games like the up and down game, getting closer to some of the relaxation protocols that we would include. But I love the 1, 2, 3 game. I use it for so many different situations. So we've looked through body language. We've talked about the games that you can introduce. It doesn't just have to be food. The other thing that I think is a really important thing, particularly for people working in a facility, is your leash skills. This is something you need to learn, something you need to practice. Not only so that you can utilize the leashes, but you understand the gear, you know how to get it on the animals positively. So a lot of these dogs may have never worn a leash or a harness, or they have done and it's been really unpleasant. They've been jerked around, they've been corrected, they've potentially had a shock collar, anything that is associated with a really unpleasant sensation. And so you need to be able to positively condition them to it. I have mentioned slip leads, harnesses, and halties. Now, I know many trainers do not like slip leads, but when it comes to moving animals around a facility, be it a veterinary or a shelter, slip leads are really, really useful. They're not for training. They are for emergency situations or moving animals around a facility. But you need to know how to handle it. So if you're going to be using this gear, you've actually got to practice it on a stuffed animal, a stuffed dog, so that you know how to get it on without causing further offense. There are lots of courses that you can do to learn how to do this, and we can't go into it in the talk, but I just want to point out that if you haven't learned appropriate leash skills using long lines and short lines, know how to lock them so that you don't lose a leash. Trust the gear, as we said at the beginning, so that it's not going to suddenly slip out of your hand. They're not going to slip out of it themselves. We want to set this relationship up to succeed. And one of the best points of advice that I would do is when you first start working with a dog on a leash, use a long one so that we can minimize pressure and minimize tension as much as possible, so that we don't get a dog coming into a shelter, they're racked up, they're hyper aroused, they're stressed, they're anxious, and we're hauling them around on a tight lead. Not only are we giving them an unpleasant sensation when they're attached to us, but we're teaching them to pull, as you would with another dog, but it's even harder in a shelter. It's even harder for these dogs. So you need to be extra good to compensate for what they have not learned in their life. When you've got the gear on and you're moving, again, the use of your body position on how you would guide the dog around a facility, through doors, getting them in and out, it's something that you need to practice. And this will be touched on with a Sophia Yin video. I've got a little video from Michael Shikasio as well. And I highly recommend looking at his aggressive dog workshop and webinars and conference if you're interested and you do work with dogs that are perhaps a little bit more difficult. But practice, practice, practice. Practice on easy dogs. How do you get a dog that's purely chillaxed to voluntarily put their head through a slip lead, voluntarily put their head through a harness? Practice that so that you're a lot more comfortable when it comes to doing that with a dog who's never had it done before, because they know if you don't know what you're doing. So we have low stress handling from Sophia Yin. This is just a little promo bite from her videos. And if you haven't looked at her handling and moving animals around a facility and you have a facility, you should get the DVD. Some of her recommendations are slightly old-fashioned now, but there's still a lot to learn from it. you haven't been headbutted by a dog, I got a black eye from a Great Dane once before I knew what I was doing. So, Sophia, absolutely, her low stress handling, leash skills, what the dog is interpreting is what our body is doing and what we are applying to the leash. So, for example, if you've not heard of the leash stroking techniques, it really emphasizes to you that what you are sending down that leash is what the dog is interpreting, which is why we want dogs that walk on a loose leash, not necessarily dogs that walk at heel. So a little bit more, and I highly admire Michael Shikasio's defensive handling skills. We're very lucky to have him in New Zealand next year, so keep an eye out for that workshop in the North Island. But this is a little video more for clients, but I think, again, it applies to a dog that's come in and is pulling a lot and is not manageable and they're all over the place. What can we do with the gear and how we handle it to enable us to make this leash walking experience more positive? So, of course, the gear alone does not do the work for you. You've also got to do the training, both you and the dog. And I think that was done quite a while ago. So if anyone wants to print off a still of that and ask him to autograph it when he comes, I think that would be hilarious. The final bit of gear that, if you are not already familiar with, is a muzzle. And I believe every dog should be muzzle trained, because too many of our lovely rescue dogs come in, they have a lot to deal with, and then they need veterinary care, or they need help, or they need care. And then they don't have the resilience to cope with that added stress on top of everything else. And then the vet gets bitten. So it should be another fun game that you can introduce to this dog's life before they need it. So if you haven't seen muzzle training videos, here's a nice little brief one that is how you positively condition a dog to put their nose in the muzzle. Muzzle should not be put on dogs unless emergency. Dogs should be voluntarily involved in this piece of gear because it's not a bad thing. Love muzzles. So with muzzles, make a note that that was a basket muzzle, not a nylon muzzle. Multiple reasons we don't like nylon muzzles. A, they can still bite you, but also it's an unpleasant experience because it's restrictive and they're unable to pant, drink, or take treats. So I think it's underutilized too often. I find clients coming to me, or I'm working with a rescue, and the dog has developed aggression, and all of a sudden, because they've had a bad experience with the muzzle, possibly at the vet, it takes a lot more to undo that rather than let's just start. If you have a new dog, we don't know their history, we don't know what they're going to do. And especially if they are a large dog with the capacity to injure someone, let's start getting muzzles in there as a pre-game for every dog that is coming into a shelter. and it's just part of what they need, and it's a fun thing, so that we can ensure safety, which is such a priority, but it's just another game that you can include that they're learning something from. So we've touched body language. You've got to understand it. What are your skills to manage these behaviors? And the final thing that is so valuable, and again, I could do a whole day on enrichment. I love enrichment. I love what we can learn from the zoo industry as well. But in a shelter environment, particularly a facility where the animals aren't necessarily allowed off that area, particularly those that are under quarantine or various other reasons, we have got to be enriching that environment as much as we possibly can, especially when we potentially are not staffed to the point where the dogs can have the one-on-one time with people to do all the things that we've discussed already. How else can we reduce their stress and increase their quality of life? And that's where enrichment covers a whole range of things. It's not just giving them a Kong or giving them an ice block. It's realizing there are so many different ways we can stimulate that environment and provide them with choice, which is so valuable, as I mentioned. And that's physical enrichment, that's walking, that's running around, playing, swimming, that's sensory, that's putting on music, that's reducing harsh noises as well. Sense, bringing in smells of different plants that they can interact with, different textures. Again, especially young puppies, that sensory enrichment is so important for their development, so they can walk across grates, metal grates, that things can flap and they're not going to be worried about. Going off the topic there slightly, but enrichment for these dogs that are in there. Nutritional, ideally we're not feeding dogs, especially these dogs who have so little to do all day. Don't give them a bowl they can inhale in 2 seconds. Yes, it's easier for the time. You put the food in and then you can pick up the bowl and everyone goes home. But they really should be fed in safe food dispensing devices. Social enrichment, this does take a little bit of planning, but we're seeing more and more play groups in the US shelters, which allow these dogs the social companionship. If we do not give them that outlet, we often start to see leash reactivity, barrier frustration, and inter-dog aggression. So finding a way to safely provide that social play date is really, really helpful. And occupational, which is more your training, doing games, parkour, agility, things like that. So you've got your adventure parks. Again, wouldn't we all love to have facilities like that? The training itself, this is enrichment. Teaching them to do things is so important. Both do they learn skills, they have a positive relationship with you, and that brain work will stimulate them more than going for an hour's jog. All of these kind of food dispensing ideas. I mean, the Kong is an essential tool, and it's worth, if you are working with a lot of dogs, I know it's expensive, but it's worth investing in things that will last. Having access to a pool, taking the dogs out for play dates and going to the beach, things like that, giving them that outlet that is not just the physical exercise, but also the sensory enrichment, the occupational enrichment, and the social enrichment. And I think we're getting almost down to the end finally. So this is just a little clip of my 3 little diarrhea puppies. They've got choice. They can go in the crate to hide away. They can come out and be in the sunshine area. They've got a couple of different styles of toys there, and they've got each other to play with as well. And then the absolute wonderful reading to dogs in shelters is really valuable as well. And I think we need more of that, where they can just be. They don't have to necessarily interact. I think this is sitting too close, this particular image, but again, just having them get used to the sound, the smell, and the movement of someone not doing much, not demanding anything from them, is really, really useful. And out of the 3 auditory soothing and calming sounds, classical, reggae, and audible books or reading are the 3 most common ones that will actually reduce cortisol stress in dogs in shelters. So I believe we have got to the ends. Thank you all so much for listening. I hope my internet wasn't breaking up too much. There are a couple of little flaws in there, but I really love talking about this topic. I could go on forever, and hopefully we've got a few questions that I'm more than happy to answer.
Thank you, Jess. That was amazing. And I've written down and underlined several times the word time. And not just because it was a little bit over your hour.
Sorry.
No, you're fine. I'm joking. But no, mainly to do with the fact that a lot of your chapters that you seem to have gone through in your slides are about taking the time to understand the background of the dog. You talked about the rule of 3. You talked about taking the time to analyze your own body language and the dog's body language, and also just giving the dogs time to choose their, what their reward is, or how they want to spend their time as well. And it's, I know that everyone feels like they're under a lot of pressure in the shelter environment particularly, and I know in vet clinics as well. And I think there's a lot of cross-pollination, I'll just call them facilities, where dogs are, and being able to spend the time with those dogs to make sure they feel comfortable. So that was absolutely tremendous. I'm looking through, there's lots of thank yous, not so many questions. I did have a question though, and one of the things that I was interested in was, when you are doing all this work on shelter dogs particularly, and they're doing okay and they're kind of ready to be rehomed, what sort of advice would you give to people about passing on the information about what work's been done, or those tips to the new guardian, or even if they're going out to foster?
Oh, absolutely. I think what's most important is to have data on these animals. So one of the biggest flaws that I've seen, especially with potentially dogs moving from foster to foster, is we're not getting like a behavioural portfolio of what these dogs have been exposed to already and how they've responded to those exposures. So I think if people could start, just as they keep a vaccination record and a flea and worming record, some form of behavioural information. So I actually have like a little behaviour questionnaire that all the foster parents would fill out, and it's very similar to the SPCA. I got the idea from them. Actually, they already do an amazing job with many of these aspects, and it ticks what this dog has been exposed to, what they're good with, what they're not good with. So you just need a little A4 or a couple of pages, or come up with your own formulation, so they have an idea of areas maybe the dog still needs work on. And what would be important is that you are recommending these people seek the right advice from the qualified individuals who can help. Either because the dog has no issues, but they just want to expand the dog's welfare by go and do these training with these trainers, or go to these clubs. Or it could be, look, they're still a little bit nervous of car rides, so here is a little handout on how to help them with car rides. So maybe having a whole, and this is where hopefully CAMS can come through, having resources that can then be shared that would indicate, okay, so you've got a nervous dog, these are the things that you might want to do to help them feel more comfortable. I think one of the best things is, again, what I'm trying to do with the veterinary community is have a relationship with the trainers in New Zealand, have a relationship with qualified professionals who can take on that support. Because what I'm also seeing, unfortunately, is a lot of rescue dogs are being adopted out. The rescue doesn't have the facilities to follow up necessarily or give them that ongoing support. And so these people are seeking help and they're going to the wrong people, and these dogs are being traumatized and being returned to the rescue at the age of 1 year after things have really backfired and gone to SHIT. So I think making sure that we are redirecting and recommending people get the right advice from the right place if they need it. I've completely gone off topic from what you asked, but
no, that's good, because you're walking straight into another excellent topic as far as we're concerned, which is animal behaviour and training accreditation, which we also do. If there's any behaviour consultants or trainers in the audience tonight, would be
it's just
very keen to talk to you.
That people know where they can get the right advice, because it's just so exhausting to know that these animals have been rescued, they've maybe overcome some difficulties in the care of a wonderful shelter, and then they've gone to a home where someone's been given the wrong advice, and it's just either undone all the wonderful work you've done as a shelter, when it can be avoided by just having the appropriate advice. So I think when they're out of your facility and they have gone on, owners need to know what they're taking on board, because the other problem would be, look, if you don't have a behavioural portfolio of what this dog is doing and it goes to the wrong family who can't cope, this dog is suspicious of bicycles, and you adopt them out to a family with 3 kids who like riding bikes. So those sorts of things need to be important. So we set them up to succeed, put them in the right environment, and then give them the appropriate context to help them with the little niggles that maybe this dog needs help with. But we can't do that if we don't have enough information on how this dog is coping. So
I do have another question here I'll get to in just a second from Dean. I just wanted to say about that too, about the shelter register Aotearoa project we're doing, is what we're finding is lots of shelters have no shelter management software at all. And we're happy to talk to people about pointing in the right direction, because there's excellent shelter software out there and it's not always super expensive. In fact, some of it's free. So we would encourage the use of that.
Exciting.
Yeah,
and they often have templates in there for you to indicate what behaviours have been expressed or otherwise. So really useful to just simplify that. So you just tick a box. You don't have to write screels of information, because we are time poor.
Yeah, absolutely. So Dean says that he works in an old council shelter that has a central lane with facing pens, and he'd like to know how best to arrange the dogs. Should all the new dogs go down one end or in the lane there away from the public initially? What's the best option?
I think it really depends on the individuals. What you want to minimize is both the visual stimuli from, I believe he means like there's a central corridor and the dogs are all looking at each other. So having, so having some way to block off that, so you want to block off those so they can't see each other, and it might end up wherever you possibly can alternating, so that even if they are seeing a dog, it's at an angle, so the dogs feel that they can hide slightly and they're not directly opposite a dog yelling at them. If you've ever seen that the video where the two dogs are walking down and then they put the subtitles where it's, hey you Frank, F you Frank, and I mean, if that's happening all day to you in a shelter because there's just some dog who doesn't know how to cope across from you, you want to minimize them being able to stare directly at each other. The other benefit of having some form of blockage, even if you're only partially blocking it or providing the animals with a place at the back of the kennel to hide away, so be behind something, be that a crate or a temporary wall or something like that. And it is hard to do because you've often got dogs that eat and chew and destroy things, but we want to think about that. The other is recognizing if you've got certain dogs that are very barrier reactive, then they really should be in another area of the kennel. If you've got any other location that you can put either exceptionally fearful dogs or exceptionally reactive dogs at the fence barrier. And this is also to cater for the fact that you might need to get them in and out. And the worst thing that happens is you get a dog out and they have to walk down this gauntlet of dogs yelling at them. So knowing that if you've got a fearful dog or a reactive dog they should be at the end so that you can get them out without going past all the other dogs. I think there are actually either behaviour consultants or people like myself who would be able to come in, look and do an assessment of the facility and say, look, here are some pointers on what we could do to minimise the stress for these dogs and make the process of moving them around the facility safer and faster. So as Tina said, hanging a sheet or something up in front. And you can have more permanent ones, so opaque perspex that you can clip on. The other benefit of that is it's very easy to clean. We've got to keep hygiene really important in shelters when we've got a lot of infectious disease. And I know what the washing pile can be like in a shelter. So permanent perspex is better than metal because it makes a lot of noise. But it's amazing the ingenuity that people come up with. If you can recognize the problem and recognize it is a problem, you're the first step to being able to fix it. Exactly, so the temporary board to reduce that stimulation and being aware of what the material is to soften some of that noise. The hardest thing to do in both veterinary clinics and shelters is minimize noise and maintain hygiene, because the two things just don't go together. So there's lots of good pointers, and in the body language lifts that I put there, Maddie Spun and ASPCA Pro also have some really, really useful and free webinars on how to manage shelters and pointers on managing infectious disease, managing behaviour, managing the facility to make it as successful as possible. So I do recommend reaching out for those resources if you don't already.
What we might do, Jess, is when we get this edited and up on our site, we might add a bit of text underneath the YouTube video so that people can find those resources easily then. We are getting very close to being a long way over time. So
I know, I'm so sorry, everyone.
No, that's right. It's good. It's very engaging and it's been really great and very well subscribed. We have sort of 100 limit on our Zoom meetings, and we cracked past that number today, which is absolutely tremendous. I was really heartened to see some companion animal guardians who aren't involved in shelters register for this webinar too, which is really encouraging. So well done to them. And the other thing, I'd just say one last thing about time. In our experience, dealing with shelters with our companion animal register, which is the microchip register for companion animals in New Zealand, and also our shelter register Aotearoa project. We've seen some really great things going on when people are collaborating and talking. So please do not suffer in silence. Don't wait for us to organise webinars for you to get together. There's lots of different Facebook groups and other ways to network. We are hosting one, as I say, for the shelter register Aotearoa contributors, and I'm very happy to facilitate discussion, because it's all this knowledge sharing. I know it's really overwhelming and people are working really hard, and I think that sharing a bit of knowledge goes a long way and makes you feel you're not quite all so alone.
Well, what I'll have to say is what I'm excited with Kiwi Vet Behaviour in Auckland. It's vaguely tooting our horn, but we are opening a behaviour centre in Auckland in January, which will be facilities for both training and behaviour consults, but also I really want to push education, so that we've got a place that people can come and we can do things like this, but live. So there's a lot more interaction. I have a great team that I'm putting together, including people with shelter experience. So without a doubt, keep an eye on my Facebook page for more information. And I'm very open to collaborating if people wanted to utilize the space as well to either introduce dogs or again, we're collaborating. We want to bring together information, socialize, even just empathize with people. There is going to be a facility in central Auckland from next year, which is hopefully going to be a location we can all take advantage of.
Very good. So I think that just about wraps us up. Thank you, everybody. Thanks again to Jess. Because of the popularity of these, we have undertaken to start doing some more shelter register webinars in the new year, and also some A Good Life webinars just on how to improve the lives of our companion animals. So we'd love it to, and maybe we'll come up to Auckland, Jess, and do one live as well.
Yeah, that'd be fabulous. Thank you so much.
Without any further ado, I wish you all good night, and thanks very much for your attendance.
Good night.